بسم الله والصلاة والسلام على رسول الله. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Osama and I'm a second year medical student and I'm here today with you explaining gastroenteritis bi'idhnillah. To begin with, we have to give a brief introduction on gastroenteritis, commonly known as what? Food poisoning. It is going to be commonly occurring in areas of poverty, poor sanitation, or even poor water supply. Its mode of transmission can be summarized by a mnemonic we use known as the 4Fs. So it can be spread by feces, by fingers, food, or flies, anything within your surrounding environment. And so when we say gastroenteritis, we are talking about a syndrome that typically contains both diarrhea and vomiting. Otherwise, usually gastritis manifests with only vomiting and enteritis usually with diarrhea only. And what is diarrhea clinically defined? It is 3 or more loose stools in 24-hour period, typically lasting up to 14 days. Otherwise, anything more than that can become chronic diarrhea. Gastroenteritis can typically fall into 4 different groups that we'll be discussing: food poisoning, non-inflammatory and inflammatory gastroenteritis, as well as invasive gastroenteritis. We need to distinguish between non-inflammatory and inflammatory gastroenteritis. What I need you to understand is that when we say non-inflammatory, we're talking about a toxin-mediated process, meaning that these pathogens are going to be acting on the small intestine without disrupting the GI tract or the wall to induce the secretions. Whereas in inflammatory, we have a full-on inflammatory process that is going to be either invasive or triggered by cytotoxins that will therefore lead to GI wall disruptions, inflammatory process, and so on. And so how can we differentiate in terms of markers? We're going to be having diarrhea here without pus and typically without blood or mucus. However, you're going to have in inflammatory gastroenteritis marked by the presence of what? Pus cells, and sometimes we can have mucus as well alongside all the other symptoms that you can read. Let's talk about food poisoning. When it comes to food poisoning, we have 4 basic bacteria that we can discuss. So when we talk about Staph aureus, why do we call it the superbug? That is because it is going to be contracted from so many different places, and that could include meat, dairy, ice cream, custard, usually anything involving what? Food handlers. So look for that keyword. In terms of Bacillus cereus, we're going to have 2 different forms: our usual emetic form and the diarrheal form. And so you can look at how the emetic is going to have a shorter incubation period and usually is going to be associated with fried rice. So look for that keyword. For example, person ate fried rice last night and then started having symptoms. So again, that could tip you off to Bacillus cereus emetic form. Otherwise, the diarrheal form is going to be, again, obviously associated with diarrhea and barbecued meat, longer incubation, and is going to last for longer. So again, memorize these and look for such key words. When we talk about Clostridium perfringens, you expect it to be found again where? In reheated foods. So it is commonly referred to as the cafeteria bug, because it is commonly contracted from such places in hospitals, schools, buffets, and such. So again, it loves this environment where, or the temperature where it's being reheated. Finally, Clostridium botulinum. I would like you to remember again from the word botulinum, again bottle, therefore associated with what? Canned foods. It loves this environment where it can thrive in anaerobic conditions, low oxygen, can be seen also in pickled goods or even honey. Now on to the bacterial non-inflammatory gastroenteritis causes. There is also viral and parasitic, but we'll be discussing bacterial only. Vibrio cholera. What do you need to know about it? There's a lot of information you can read for yourself, but again, you need to remember the key words. One of the most important keywords being is that it is comma-shaped. Again, what we call gram-negative, flagellated, curved rod. They usually use the word comma-shaped in the question. So again, that can give you an idea. Or also added to it, we can hear that it is what been contracted after ingestion of contaminated water and food. Commonly also what? From shellfish, as we'll see in the next slide with the different variants. It can produce what we call the rice water stools. What does that mean? Just simply profuse watery diarrhea. Again, that looks something like this. That's why they call it the rice water stools. These different types of, again, the Vibrio species, you have your cholera, parahemolyticus, and vulnificus. We discussed Vibrio cholera already. Again, usually, like we said, contaminated food or water, can be asymptomatic to more severe, again, what? Diarrhea. Like we said, from raw shellfish, if you don't know what it looked like. Another point that examiners focus on is vulnificus. This is usually contracted following what? a wound injury. Commonly might come in the question, a person was running on the beach and then they injured their foot and contracted an infection following that. So again, like we said, usually vulnificus with wound infection, so primary septicemia, and those with iron overload. Why iron overload? Because they're undergoing regular transfusions, therefore they can be exposed to what wounds, and therefore the bacteria can thrive. With the different strains of E. coli, we start first with what we call entero-invasive. From the name, again, is a given that it is going to be invasive in nature, causing, therefore, again, obviously damage to the lining of the GI, leading to dysentery. What is dysentery? Diarrhea that contains mucus and blood. Again, it is the giveaway is that it is clinically very close in manifestation to Shigella, which we'll discuss soon. In terms of enterotoxigenic, again, to make it easier, T toxigenic, meaning it is going to be associated with what? Traveler's diarrhea, very, very common cause of E. coli. And we, from the name toxigenic, meaning what? We will have toxins produced that are both heat labile and stable. Next are enteropathogenic, P, associated with what? Pediatrics, most commonly seen where? In children. Again, or also you can take the fact that it is called epic games is played by children. And in the enteropathogenic, we're going to have no toxins produced, but because it is going to adhere to the apical surface, destroys the villi that are responsible for absorption, and therefore there's no absorption, leading to what? Diarrhea. Finally, enterohemorrhagic is a given from the name. Hemorrhagic in nature, meaning it is going to lead to profuse bloody diarrhea. We're going to be commonly seen via uncooked meat. So again, you can see the 3 H's: hemorrhagic, hamburgers, and hemolytic uremic syndrome. What is hemolytic uremic syndrome? It is basically a rare disease. However, it is going to be affecting the kidneys and the blood clotting functions of what people infected with EHEC, and will be presenting with a triad of anemia, thrombocytopenia, like we said, acute injury due to the microthrombi. Inflammatory gastroenteritis that usually presents with fever and complains of abdominal cramps while trying to defecate. So tenesmus is difficulty defecating, or basically having sensation that you want to defecate but there's nothing coming out. Campylobacter jejuni. Now, again, the usual, yes, thin curve, multi-gram negative. You can read that for yourself. What do you need? What are the key terms? Is that it grows at 42 degrees. Commonly seen after, again, ingestion of poultry. Never forget. It is going to be presenting with bloody diarrhea in children. Something that's usually overlooked is that it is associated with what? Guillain-Barré syndrome. Very, very commonly, most common cause usually of Guillain-Barré is Campylobacter jejuni infection. Now, what is Guillain-Barré syndrome? It is basically ascending what? Paralysis that usually begins at the from the legs and then starts all the way up, leading eventually to what? A respiratory tract paralysis. So the question might come with something like that. A child presents to the, again, hospital with ascending paralysis starting at the legs. Maybe they start throwing in that they ate something last night, poultry, and that bacteria grows at 42 degrees. You answer Campylobacter. To Cholestrodioides difficile. Remember that this is gram-positive. It is associated with what we call prolonged use of broad-spectrum antibiotics. What does that mean? It means that when you have been using antibiotics for so long, then you are going to be disturbing the, again, what normal protective flora, and therefore allowing for other microbes within your body to flourish, and therefore can lead to pseudomembranous colitis, like we said, again, associated with C. diff. So remember, the case might tell you that the person has been taking antibiotics for a long time and therefore starts developing an infection. Again, think of C. diff. And like we said, antibiotic associated diarrhea is going to be caused by, again, prolonged usage of these antibiotics. When it comes to Shigella, the gram-negative non-motile rod, you have to keep in mind that it is going to be associated typically with areas of very poor hygiene. So it used to be very commonly spread in areas of what? War zones. It is going to be spread as seen by the 4 F's: your food, finger, feces, flies. So again, all different types of transmissions. It will initially present. So the patient will come and tell you, I had initially watery diarrhea that then progressed to bloody diarrhea. So again, you can start building your profile. It is very virulent. So it can spread very easily, even like with a small, tiny number, and can present with dysentery, meaning what? Again, like we said, bloody mucus-containing diarrhea. What is similar to Shigella that we mentioned earlier? Your entero-invasive E. coli. So, linked together. The last type we'll be discussing, invasive gastroenteritis. Again, from the name, it is going to be invading the epithelial lining of the gut, leading to inflammation and ulceration of the GI mucosa. Finally, Salmonella. Again, just keep in mind a gram-negative rod with flagella, motile, and invasive. Again, usually what is distinct about it is that it is spread from contaminated food, like always, poultry, eggs, and dairy. Especially consider eggs here in Salmonella. Remember, they always warn you not to eat cracked eggs raw. And oddly enough, turtles as well. It can lead to typhoid disease, and what's it called? Can typically manifest typhoid fever as rose spots on the abdomen, as we can see here. So again, that can be once again in the case presented. Highlighting the difference between Salmonella and Shigella, you can read on your own, but I just want to say yes, both are non-lactose fermenting. However, again, on the culture, we can see that Salmonella produces H2S that appears black, whereas Shigella does not. And thank you guys for watching this video. Barakallah feekum. And make sure to like, subscribe, and comment. And if there is any feedback on how we can improve, please don't shy away from telling us. وصلي اللهم وسلم على محمد وآله وصحبه وسلم. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.